covering is not a substitute for physical distancing. Please continue to maintain 6 feet of distance between you and anyone who is not a member of your household.
These steps are critical to our efforts to box in this virus and keep Wisconsinites safe. So mask up, Wisconsin.
And let's get through this together.
Good afternoon, and thank you for joining us for today's COVID-19 media briefing. This is a Q&A about vaccine. It is being aired live on YouTube. Joining us today are DHS Deputy Secretary Julie Willems Van Dyke and Dr. Stephanie Schauer, Division of Public Health Immunization Program Manager and a part of our COVID response team. And we begin today's briefing with remarks from Deputy Secretary Julie Willems Van Dyke.
Well, good afternoon, and thank you for joining us today. Yesterday, we reached a vaccination milestone here in Wisconsin, over 1 million doses administered. What a great day. To put that in perspective, it took 48 days for us to administer the first 500,000 doses of COVID-19 vaccine. And it took us only 18 more days to administer the next 500,000 doses and get us over 1 million. We are on a roll. As of today, we have administered 1,070,201 doses of COVID-19 vaccine here in Wisconsin, and 289,755 of those were second doses, which means 289,755 Wisconsinites have completed their series and are fully protected against this disease. We are one of the top states in the nation for vaccine administration, and over 40% of Wisconsin residents aged 65 or older have received their first dose of vaccine. This is really exciting news, and we have a great team to thank for it. We also still need your patience and your perseverance going forward. It will take more time, but everyone in our state will have the opportunity to get vaccinated. I wish I could give you a timetable, but so much of the timing depends on our allotment from the federal government. What I can tell you is our allotment is growing. Next week, we will have 115,000 doses, first doses to distribute to our vaccinators, which represents a 64% increase from mid-January. And we have been assured we will have this amount for at least the next 3 weeks. In addition to our state's allotment, 18,000 doses per week are also available through retail Walgreens pharmacies for currently eligible groups, including frontline healthcare workers, police, fire, and corrections staff, and people 65 years and older. We appreciate the growth in vaccine. However, it still falls far short of the 350,000 doses that our vaccinators requested this past week. Our team, the staff at DHS, our local and tribal health departments, health systems, clinics and pharmacies, and all our vaccinators are committed to getting every vaccine in arms as quickly, as safely, and as equitably as possible. And they are ready to administer far more vaccines than we currently receive. Today, we are announcing a new tool that is coming soon, the Wisconsin COVID-19 Vaccine Registry. We are making this registry software available to local and tribal health departments to help streamline the vaccination process going forward by providing this central scheduling resource. Starting next week, a few local health departments are going to pilot the registry software to make sure it's working the way we want it to. And after that, we'll begin rolling it out to other local health departments that have expressed interest. So stay tuned for more information. As we continue to vaccinate Wisconsin residents, please keep doing what you're doing to stop the spread of COVID-19. It is still with us, and we need to protect ourselves. Stay home, wash your hands, practice physical distancing when you have to go out, and wear a mask. Check to make sure it fits well. Your mask should cover your nose and mouth with a snug fit in order to form a barrier for respiratory droplets. We need to remember that COVID-19 is still present and spreading in our state. We are adding 733 new cases today, which brings our total confirmed cases of COVID-19 to 557,722. Our 7-day average of cases is 658. Today, we also report 18 more Wisconsinites who have lost their lives to COVID-19, which brings the total number of deaths to 6,232 people. Our thoughts are with the families and friends who have lost loved ones to this virus, and it is up to all of us to take action to help prevent further loss. So thank you, and I will turn it back to Elizabeth, who will lead us through your questions.
Thank you, Deputy Secretary. Let's start with, of course, what we tell you every time. To maintain audio quality, we ask you to remain muted until it's time to ask your question. If you are on the phone and you're able to do so, please use *6 to mute and unmute. And we begin today with Rose Schmidt at CBS 58 in Milwaukee. Rose.
Hi, thank you for taking my question. I guess, can you talk to us more about the new tool that you're rolling out with the registry? And I understand that it goes on March 1st. So can you talk about how that's going to coincide with the new eligible groups that you have available starting on March 1st? Thanks.
Sure. The tool is a tool that will do several things. First of all, it will screen for eligibility. Second, it will guide people in making an appointment. And third, it will then serve as an efficient way once you arrive at your appointment to connect your information with the vaccinators and track your vaccine information. So you will log into the site, you will fill out some demographic information, You will answer a series of questions that will determine whether you are currently eligible for vaccine or not. If you are eligible, it'll take you to a list of vaccination sites that are near your home, and you'll be able to schedule an appointment. If you're not eligible, it will put you on a waiting list for you to be notified at a future date when you would become eligible. It will send you an email that will have a QR code, and when you come to the vaccination site then for your appointment, the vaccinators will scan that code. They'll update your health information, just review important information about the vaccines, confirm your health history that it's appropriate for you to get the vaccine. You'll receive your vaccine. The same system is used to record that vaccine. Much of this is done by barcode scanning. So again, it makes it very efficient. That information about you and your vaccine will be sent electronically from the system to the Wisconsin Immunization Registry. And it also will then provide reminders for you to schedule your second dose. Remembering it's not just one dose, it's 2 doses for our current vaccines, and very important that people get them. So as it relates to the new eligibility groups, those will all be incorporated into the screening criteria in the tool. And so it'll be really helpful. Anyone using this will be able to immediately, by using the tool, screen for those eligibility groups.
Thank you for that. The next question to Georgina Fernandez, WJFW in Rhinelander. Georgina. WJFW in Rhinelander. A reminder, *6 will mute and unmute your phone. All right, we will try to get back to that outlet. Let's move on to Mary Pouch, WQOW in Eau Claire. Mary, WQOW.
Hi, this is Katrina Lim filling in for Mary at WQOW. Hi, thanks for having us.
Thank you for taking my question.
Yeah.
So I was wondering right now.
Is
Okay,
there someone else talking at the same time?
Mary should be asking a question right now. Georgina, if you're with us, we'll come to you next. Let's go to
Hello,
Mary
can you
right
hear me?
now. We're taking Mary's question right now. Mary,
Okay.
why don't you
Hi,
go
this
ahead?
Okay. Thank you. Hi, this is Katrina filling in for Mary
Oh,
at WQOW.
thank you. Apologies.
Yeah, it's okay. It's okay. Hi there. Yes, thanks for taking my call. So recently there was a study done by the New England Journal of Medicine, and they were saying how, you know, with the scarce supply of vaccine, that, you know, they're recommending that we give, you know, more vulnerable people first doses rather than doing, you know, the normal like first dose and then 3-4 weeks later giving that second dose. Is the DHS, you know, considering recommending this to, you know, places in Wisconsin as well to maybe help with that scarce supply of vaccine, you know, giving more first doses to more people rather than a first and then a second? Thank you.
I'd love Dr. Schauer to respond to that question.
Sure. So it certainly is an interesting result. I think it's important to note that it's unclear about the net public health effects that might come out of this in terms of short-term versus long-term. And I think at this time, we do continue to stick with the evidence-based approach and those recommendations from ACIP that are currently in place, and that is to continue administering 2 doses of the currently available vaccines at the appropriate time.
All right, thank you so much for that. We will now go back to Georgina Fernandez at WJFW. Georgina, a *6 should unmute you. All right, as we try to figure that out, why don't we move on to Bram Sable-Smith, Wisconsin Watch. Bram.
Hey, thanks for taking my call. My question is Wisconsin tracking the number of vaccines that are being thrown away or discarded? And if so, are you tracking that by dose, by vial? How is that calculated?
Yes, we are, and I'll turn to Dr. Schauer to give you further details.
Yeah, so providers are required to be accountable for all doses, whether they're administering them or whether they end up being wasted or unable to be used. We do have them track that at the dose level because, as you know, with vials, they have recently gone from, with example of the Pfizer, from 5 to 6 doses. So they do need to report at the dose level, and that is important information that they report through the Wisconsin Immunization Registry.
Thank you for that. Let's now go to Daphne Chen at the Milwaukee Journal Sentinel. Daphne.
Hi, thank you for your time as always. My question was about the registration system. In other states, it's run into glitches and problems recently, like Iowa and New Jersey. So I was wondering if there's anything special or unique about the software in Wisconsin that you guys feel confident that we're not going to have similar issues here. Thanks.
Well, you know, when it comes to computer software, there is no guarantee that you will never have any glitches. But what I am confident about is that we have an incredible team that has been working on this, that is committed to it, that when we do run into any kind of glitches, we will know it quickly and we will solve them quickly. We are working with Microsoft on this tool. We have worked with Microsoft throughout our testing portion of the COVID response, and overall the tool we've used has worked very well. Even with that tool, however, there have been times, there have been glitches, and we've been able to solve them in a relatively short period of time. The other thing that I would say is that one of the important things about any time you use an electronic system is that you have a way to back up if you have to go to paper. So if a system was down, we would, at our sites, go to backup paper resources and enter the data in the appropriate systems at a later time. So, you know, no software is foolproof, but the key to it is having adequate resources to address this. And also, when you're working with a vendor, adequate metrics to assure their commitment to fixing glitches as well too, which we've worked into the contract that we've negotiated with Microsoft as well.
Thank you for that. Let's give the next question now to Rachel Hotmeyer, NBC 26 in Green Bay. Rachel.
Hi, I hope I did this right. I hope so. Also, thank you so much for that great last name pronunciation. My question is, I am trying to cover with as much data and scientific and official response as possible, the somewhat anecdotal response that we've heard from viewers that they're feeling side effects more significantly on the second dose of both popular vaccines than they are the first, and just, how to be prepared for those sort of situations. So do you guys have any sort of official or administrative response to that? How would you tell people getting the vaccine to be prepared, and what are your thoughts on that situation as a whole?
Great. Again, let me turn to Dr. Schauer for a response to that question.
Yeah, no, you certainly are right, is that individuals are reporting that they may feel more of a systemic response after that second dose, or individuals who have previously had COVID and are now being vaccinated. It is important that everybody who is vaccinated understands that these symptoms are an expected part of immunization. It shows that the body is responding. We know that, a fair number of folks may experience some fatigue or headache or muscle aches, or pain or redness at the site of injection, and that those are normal, but they are self-limiting. And certainly if they last for longer or they have any concerns, they should contact their doctor. But that response shows that they are mounting an immune response. So they may not feel great for a day or two, but the benefits certainly outweigh that short-term discomfort.
Thank you for that. Let's give the next question to Addison Van Patten, WAOW in Wausau. Addison.
Hey there, thank you for taking the time. With Wisconsin's COVID cases dropping in many different counties, and Dr. Fauci recently talked about how obtaining herd immunity is potentially in the next year and the next year of the future. Do you think the dropping cases in Wisconsin is related to that potentially happening here? And if you don't think that's happening here at this time, when do you think we could potentially see herd immunity in the state of Wisconsin? Thank you.
Well, our goal through vaccine for herd immunity is 80% coverage. We're currently not quite there. So I'm not sure when we'll be there. Our goal is by June. I don't think we're going to have enough vaccine supply to get there by June. So it's really largely linked to when we'll have vaccine supply. Hopefully by the end of the summer, but it is a direct linkage to vaccine supply. Now, I know sometimes people add on, in addition to immunity achieved through vaccine, we also know that people have antibodies from prior infection. However, we do not know how long those antibodies will persist from prior infection. And we've also seen cases around the world where when the vaccine mutates, that natural infection has not protected people as well as hoped for. So I'd rather see herd immunity achieved through vaccination than relying on a certain percentage of the population that's been infected. And our best guess, really quite frankly, along with Dr. Fauci, is sometime later this year.
Thank you for that. Next question now to Mary Jo Ola, TMJ4 in Milwaukee. Mary Jo. TMJ4, *6 will mute and unmute your phone. TMJ4.
Hi, okay, I think I got it down now. Thanks for taking my question. Just curious, I know we've heard about this in other areas of the country, but is the weather anywhere in the U.S. impacting vaccine supply getting to Wisconsin? Thank you.
Dr. Schauer, do you know if the weather has affected any of our deliveries this week?
Yeah,
Oh, you're muted.
Thank you. We do know that the majority of the vaccine deliveries that came to Wisconsin were able to get here without any impediment due to the weather. However, we did speak with Walgreens today, and that pharmacy retail program with the federal allocation, they are experiencing some delays because their vaccine through that program is shipped later in the week. And so as we look at the weather patterns and affecting the southern part of the states, much of the vaccine does get shipped through some of those states. And so they are experiencing delays. But we're happy to say that with the exception of a handful of providers, all who received allocations from the state did receive them this week.
Wonderful, thank you. Now to Sean Kirkby at Wisconsin Health News. Sean Kirkby.
Hi, thanks for holding this. I know there was a federal program getting some vaccine doses straight to community health centers. Can you share any information about that program's impact in Wisconsin?
Sure. Dr. Schauer, would you like to speak to that as well, too, please?
Certainly. So the federal program for doses going to federally qualified health centers is a slow rollout. They were starting with, I think, 25 health centers in 7 states, and Wisconsin was not one of them. However, that program is being expanded, and we have been contacted about a number of FQHCs here in Wisconsin that are slated to occur or might be included in subsequent phases. So we will see Wisconsin federally qualified health centers be included in that program, but they weren't certainly in that first week. And we certainly look forward to having this as another way to add doses into the state of Wisconsin. These will come from a federal allocation and once again are not from the state allocation. So those doses will be on top of what we already receive and going to locations where they serve a population that really is needs the vaccine and is an underserved area.
Thank you for that. Now we go to Heather Poltrock, WSAW in Wausau. Heather, WSAW.
Thank you. Certainly more vaccinators are signing up all the time. And I wanted to know if you could share what that looks like on the back end. Like once they sign up, what happens, or what has to take place at DHS next? And then will there ever be a time where you cap the number of vaccinators, I guess at least in a certain area?
Yeah, what it looks like from our perspective is once the vaccinator has gotten through the enrollment process, which requires a number of exchange of documents, signature of documents, identification of the appropriate medical director, the appropriate location for delivery of vaccine, those vaccinators then become eligible for the weekly survey allotting vaccine. And they submit how many doses they want, and then they're factored into the allotment for each of the geographic areas. Because we do have so many vaccinators right now, and because we do not have enough vaccine, a number of those vaccinators do not receive any vaccine on a weekly basis. And so I think what I continue to remind folks at the local level is we're not only planning for today and the amount of vaccine we have for today, but we are planning for a day that will hopefully come later this summer when we have more vaccines authorized, when we have higher levels of manufacturing. And I look forward to that day when we have more vaccine than we have demand. And so we'll need all those vaccinators reaching out to their own populations, to their own patients, to their own employees, to their own customers. So it's a very solid strategy to have many different avenues for people to get vaccine and many different avenues of vaccinators reaching out to people for vaccine, and especially as we look forward to that day when we will have more vaccine.
Thank you for that. Let's go now to Madeline Anderson at Fox 6 in Milwaukee. Madeline, Fox 6.
Hi, I have a question about pregnant women and the vaccine. I was just wondering why the state has not included pregnant women yet as its own priority group when pregnant women have a greater risk of becoming seriously ill from the virus or even dying. And then a follow-up question to that is DHS going to consider including pregnant women as a priority group, either at the end of phase 1B or as part of phase 1C? Thank you.
Dr. Schauer, would you like to speak to the vaccine and pregnant women?
Yeah, so pregnant women, certainly are recommended to receive the COVID-19 vaccine. It's a discussion that ACIP says have with your healthcare provider and determine in terms of the risks and the benefits. As you mentioned, pregnant women have a much higher risk of adverse events following COVID disease. And so it is important that pregnant women are vaccinated. They, as many others with chronic health conditions, also have increased risk, and those groups are mentioned later on and in subsequent groups if you look at what ACIP has noted. So yes, they certainly have an increased risk, and there's many individuals. Certainly if a pregnant woman falls into one of the categories, such as currently being a healthcare provider or such, they would be eligible for vaccination at this time.
Thank you for that. Let's go now to Eric Gunn at the Wisconsin Examiner. Eric, Wisconsin Examiner.
Hi, thank you for taking this. On the floor of the legislature this week, one lawmaker described a rural county in which the gap was fairly large between the number of vaccines that had been requested and the number they were getting, and said that based on that math, they thought the number of people who were 65 and older would take 13 weeks to be vaccinated just in that county. And yet I'm looking at your own data, and there's a big disconnect between that. It's showing, frankly, that there have been already quite a number of people, and even, you know, several hundred doses each week. What is your explanation for the kind of disconnect that there seems to be between people who say that things are, you know, much slower and much fewer, and what your own numbers are showing?
Well, that requires a certain amount of hypothesizing. And so I think certainly, you know, people are influenced by different ways they get information, right? And so one piece of information is to go to the website and look at the data and look at it through a quantitative lens. Another way to get information is to listen to the stories of people in a community. And if you run into the person who feels like they're not getting, you know, who sees that they asked for vaccine and didn't get as much vaccine as they had requested, you're going to feel very differently about what's happening in that community. So there's different inputs into how people perceive a situation. I do know, you know, this is a challenge with our vaccinators, is that everyone asks for more vaccine than almost everyone asks for more vaccine than they receive. Most of our vaccinators are only receiving around 25 to 30%, some even less than that. I mean, as I mentioned, many vaccinators get 0 doses, so they're getting 0%. And so we, as I've said before, we are allocating vaccine according to the population of counties, not simply related to how many vaccinators are in that county. And so we're working very hard to give vaccine proportionately throughout the state. We are also beginning to look at the data we issued last week and saying, you know, if we know we have vaccinators ready to vaccinate in communities with lower rates of vaccine uptake, we're looking at targeting more vaccine to those communities. I mean, clearly we have a few communities that are getting very close to having almost all of their older adults vaccinated. And so until we're ready to move into new populations, it makes sense that we would give those communities a little bit less vaccine, and communities who have not gotten to that same level, more vaccine. So it's a constant retooling that we are looking at in working to get this limited supply of vaccine, which is not enough for any county in the state, out to our vaccinators in a way that continues to lift all boats and improve vaccination rates across the state.
Thank you for that. Next question to Caroline Peterson, NBC 15 in Madison. Caroline, NBC 15.
Hi, thanks for taking my question. We've been getting a lot of questions from viewers about eligibility when it comes to people with serious health issues or pre-existing conditions that could make them more susceptible to getting COVID and are under 65, so they're not in, you know, that current priority group. When will they be prioritized and able to get a dose? And kind of what's currently outlined now and when they might be eligible?
Yeah. So I don't know yet when. As many of you are aware, on March 1st, we're going to begin opening eligibility to that large group of folks that the State Disaster Medical Advisory Committee approved earlier this month. And that population that includes educators and people in our food service industry, people in other congregate settings, 211 operators, and a variety, transit workers, utility workers, a variety of other essential workers. That group is about not quite as big as the 65 plus population, but close, probably in the range of about 600,000 to 700,000 people. And so our 65 plus population was about 1 million people. And so we know it takes us a good month, 6 weeks to get about halfway through that population. And that's our general goal, is as we enter Each new eligibility group, when we anticipate we'll be about 50% of the way through that population, then we look at announcing and including the next population. So people with other comorbidities will certainly be a consideration for us as we move into that next population group, and I anticipate that that would likely happen sometime in mid to late April.
Thank you for that. Let's go now, next question, to Todd Richmond at the Associated Press. Todd Richmond.
Hi there. Hi. Former Governor Tommy Thompson today announced that UW System's goal is to return to in-person classes for 75% of courses across the system in the fall. He's really pumped up about it. I mean, you know, he's Tommy, but he was especially enthusiastic today. You know, he's making statements like, "We're completely safe. Our positivity rate is under 1%. It's gonna be fine. We're through it." You know, do you have any thoughts on whether come fall is 75% in person a realistic goal for the system?
Well, you know, this once again comes back to the crystal ball of all of the many different factors that influence whether that will be safe or not. But I think there is some encouraging information to support that we're going to be in a much better place in the fall. You know, we are seeing reductions in case numbers. I just reported those earlier, and they are at the lowest levels that they've been since late September, early October. However, I want to remind people, in late September, early October, when we had those case numbers, we were horrified by them because we were on the upsurge and we could tell they were growing every day. They look a lot better when you're on the downsurge, but they're still terribly high. So I think if we continue to see the reduction in cases that we are seeing now, I think we're going to be in much better shape to be looking at more in-person instruction at the collegiate level as well as the K-12 level. We're going to be looking at a place where it's more likely that people will be going to work and be person to person. But it will depend on ongoing access to vaccine and increasing vaccination rates. It will depend on what we're seeing in terms of case numbers, and that is largely linked to what may happen in terms of the variants that we've been discussing. It depends on our commitment to continuing to think through safety mechanisms that we may need to keep in place. If we haven't gotten to that level of 80% herd immunity. So, you know, 75% of students attending face-to-face classes, as long as they are diligent with masking and social distancing when they're in those kind of congregate settings, is probably a lot more realistic than thinking we're just going back to life pre-COVID when nobody cared about washing your hands. Well, hopefully we cared about that, but physical distancing and masking. I think we're going to be in a longer transition period with continuing to do those protective behaviors. And as long as we do that, we'll be protecting and guarding against what happens next. We just need more time with more decrease and more assurance that we're not going to see a surge from the variants. And those are the unknowns, along with what the vaccine supply will look like. And frankly, what the uptake of vaccine will be when we get past the early adopters. Because if we stall out at around 50% coverage, that's not going to be good enough. And we're going to need to continue to encourage people to consider the vaccine seriously and contribute to the greater good by obtaining that vaccine. So those are the factors in place, Todd, that I think we need to evaluate. You know, I would never bet against President Thompson. I hope that it absolutely is where we're at, but I would be just a bit more cautious saying we've got a lot of experience that we need to get through to be sure of that.
Thank you for that. Next question now to Danny Maxwell at WKOW. Danny, WKOW.
Hi, thanks for doing this. At the beginning, Julie, you mentioned that we're one of the top states in the nation now for vaccinations, and you said our allotment will be increasing next week, which is great news. I guess I'm kind of wondering about other states who are ahead of us in the vaccinations. Were those states getting more vaccine in Wisconsin at the beginning, or how was that determined? I guess what I'm getting at is, do you think we're getting our fair share, and have we been, especially compared to states close to Wisconsin?
Yeah, I think we've been getting our fair share. You know, Wisconsin is about 1.7 to 1.8% of the total population, and every time the federal government tells me how many vaccines have been manufactured and what is going to be distributed next week, you better believe I'm doing that math to be sure we're getting our fair share of those. And you know, when the newest allocation is based on 13 million doses being manufactured a week, and we're definitely at 1.7% of that. So many of the states that are ahead of us are states with significantly smaller populations than us. And, you know, I think it's a little bit easier when you have a smaller population to get a higher percentage of them vaccinated quicker. I think I just have to give a big shout out to the incredible team here in Wisconsin, to the philosophy that more vaccinators and more access points is an effective way to deliver this vaccine, to the willingness of Wisconsin people to want to receive the vaccine. And I think all of those things, our vaccinators and our public and the steady increase in supply, have all contributed to our great success over the last month or two.
Thank you for that. Next question to Shemaine Mills at Wisconsin Public Radio. Shemaine, Wisconsin Public Radio.
Hi, I'm wondering if the department has heard of any health systems that have counterfeit N95 respirators.
Shemaine, I am not aware of any reports. I could ask our media team to double check with our colleagues at Wisconsin Emergency Management and get back to you to see if they have. I know we have sent out notices about counterfeit N95s and asked people who are, we've looked at our own supply of N95s that we've been distributing and found none, but we can check and see if we've had any reports from any health systems.
Absolutely, Shemaine, we will get back to you. And we will go now to Katrina Nickel, WLUK in Green Bay. Katrina, WLUK.
Hi there, thank you for taking my call. So this March 1st date is approaching, and previously you had mentioned that you wanted 50% of the 65 plus population to be vaccinated before or around that date. Do you guys think you will get there? And also you mentioned that the phase 1B group is about 700,000 people population-wise, and it takes about a month to 6 weeks to reach that 50% group. With the allocation we're receiving right now, how long do you think it will take us to get through 1B? Thank you.
Yep, thank you. I'm pretty confident we'll be at 50% statewide on people 65 plus by March 1st. The pace that we are going at indicates that we are likely to be there. I want to say it's a big shout out to our vaccinators, because to get to 50% of people having had at least one vaccine, remember over the last month, that means 50% of them are now starting to be ready for their second vaccine. So our vaccinators are very, very busy, because they are not only giving first doses to people who have not yet received their first dose, but they're giving thousands of second doses as well today. In fact, today was the first day in the daily reported data that I looked at where second doses were higher than first doses. So let's all please remember our good vaccinators who are doing due diligence to make sure everyone gets their second dose as well. So in terms of the next population and when we'll be at 50%, it's always a little bit hard at this point in time to predict that. We'll be able to predict that better after we've had a couple of weeks of experience. And also as we continue to see where our vaccine supply goes and how we're getting there. The other thing is, it's also going to be a little harder to know when we're exactly at 50% of the next group, because we can't track them in the same way as we can our 65 plus population. We know the age of people and we know what the total population of people over age 65 is. We're not going to know exactly who's vaccinated in the next few weeks. You know, who is an educator, who is a grocery store worker, who is a utility worker. And so it will be both, it will be a lot more estimations based on how many doses we know were given to people age 65, and then informed assumptions about the remainder going to others in group 1B. But one of our philosophies or our planning assumptions about how we do vaccine is that we're always looking forward to the next group, and we're always getting ready to bring them in when we're about halfway through the current group, so that we keep enough people seeking vaccine to keep vaccines going into arms and keep the demand equal to the supply that we're receiving. So my best guesstimate based on past practice is we'll be ready, we'll be around that 50% mark sometime around mid to late April, but that could change based on vaccine supply or based on uptake.
Thank you for that. Let's go now to Austin Montgomery at the Beloit Daily News. Austin, Beloit Daily News.
Hi, thank you for taking my call. We learned today from Rock County public health officials that the county will be launching a registry for vaccine registration starting on February 22nd. Can you confirm if they are part of the pilot program here? And would you also be able to name the other counties that will be participating? Thank you.
Yeah, I don't have the list of pilot programs in front of me, but we'll work on follow-up on that.
Absolutely, we will get that to you, Austin, and we will go now to Rob Sussman, WTAQ Green Bay. Rob Sussman.
Hi, yeah, thanks for taking my question. My question is one of definitions. I know it's been a while since we've had discussions on this, and I was wondering if anything had changed. How are you currently defining someone who is positive for COVID-19? I know that the antigen tests have come out. I know that they're generally considered to be less. There's a potential for false positives and false negatives with the antigen testing. My question is, has there been any changes to how a positive COVID-19 patient is defined? Thank you.
Thanks, Ron. There haven't been changes. A positive case is still defined as someone who has a positive PCR test. Someone with a positive antigen test is considered a probable case. If they are, many times there may be a situation where you may think it's a false positive because the person has no symptoms, and so then that person would receive a confirmatory PCR test. If that positive antigen test is confirmed with a positive PCR test, then they go from being a probable case to being a confirmed case. And so that is still the way we define confirmed and probable. We also can classify someone as a probable case if they have COVID positive symptoms and have been a contact to someone who is COVID positive, even without a test. That's a fairly small percentage of the probable cases that we report, but that is another way that someone could be identified as a probable case. But right now, confirmed cases are cases that are identified through PCR testing.
Thank you. We now go to David Welbert, Wisconsin State Journal. David, Wisconsin State Journal.
Yes, thank you. How many doses has the state-run clinic in Rock County administered since it opened, I think, on Tuesday? When and where might the state open a second or more similar clinics? And any word on when and where the federal government may set up clinics like that in Wisconsin?
I do not have the number of doses from the Rock County Clinic. Dr. Schauer, do you have that readily available? If not, we can get that back to you on that, David.
Yeah, I don't have exact. It is approximately 200 per day, but we can get exact numbers and confirm.
Great. In terms of the next sites, we're in the midst of making final decisions and confirming those, and we'll be making announcements very shortly, David, about where those next sites have been. We've been doing quite an extensive analysis across the state about looking at a number of factors that have influenced those site selections, and those will be coming soon. And in terms of federal sites, there is exploration of a federal site in Milwaukee and still further planning and exploration calls going on about that at this point in time.
Thank you for that. Now to Stephanie Hoff at WisPolitics. Stephanie Hoff, WisPolitics.
Hi, thanks for taking my call today. My question is about the alternate care facility at State Fair Park. It hasn't seen a coronavirus patient since Christmas Eve. I'm just wondering, what's the plan with that facility? Is it going to stay as a backup hospital, or is it going to turn into a vaccination site? Whatever you can tell me.
You bet. So the alternate care facility at State Fair Park is in what we call cold status. As of this week, on Monday, it went into cold status. And what that means is basically it's closed, and we do not have any current staffing assigned to the alternate care facility. We still have, the facility is in place. If we faced another surge of COVID-19 cases and we're in need of it, we could put it back into operating status again by securing staff and turning all the lights on again. But right now it's in cold status. We are looking at decommissioning the site, and we have paused on a specific date for decommissioning, largely related to wanting to pause and see what happens with COVID variants, which we know are happening in our state. As you've probably heard, a number of national experts have hypothesized that we could see another surge of COVID-19 based on these variants sometime in the next 4 to 10 weeks. And so we want to we're on pause, waiting to see what happens. In the meantime, we're not just on pause twiddling our thumbs. We're out there vaccinating every person we can, which is our other way to combat the variants. So it's, as you might imagine, it's a balancing act. You don't want to close it too soon until you really believe we're on the other side of this pandemic. Yet we don't want to keep, we don't want to tie up State Fair Park too long if we're truly not going to need the facility. So we continue to evaluate the data as it is, and we'll be considering recommissioning in the next month or two.
Thank you for that. Last question to Matt Smith at WISN in Milwaukee. Matt Smith, WISN.
Hi, as you guys well know, officials here in Milwaukee and Milwaukee County have raised concerns in the past week about the disparity when you look at population and demographic in the number of vaccines Milwaukee County is receiving. Curious, since your last update or since this new data went live, what changes have state health officials made in terms of distribution in your conversations with Milwaukee County officials, and why wasn't population taken into consideration right away?
Yeah, We certainly are looking at all the data, and the data are influencing our allocation. I looked at the allocation at the end of last week, and you know, I know a number of people have compared Milwaukee County to Dane County, and I can assure you that Milwaukee County got well over double what Dane County received, both based on our formula and based on the requests from our vaccinators and based on the other factors that go into the model. So we are definitely attending to this. We are definitely attending to thinking about ways to increase access in Milwaukee County. You know, as you've heard, we're exploring the possibility of a FEMA site there. We have provided the city of Milwaukee with vaccine as a high throughput site throughout the last few weeks to preserve their access to vaccine. And we're working very closely with the city and others to think about ways to get vaccine into neighborhoods where we see those disparities happening through our federally qualified health centers for certain, and also have encouraged Milwaukee to consider use of our mobile vaccination teams to focus on neighborhoods where vaccine may not have been as prevalent as we would want it to be. We originally distributed vaccine largely based on healthcare providers and healthcare systems because that was the group that was being vaccinated through that very first phase. And so it wasn't as much about population in the very early days of vaccine rollout. It was really about where were the healthcare providers. And so that's how we distributed vaccine in the first 2 to 3 weeks of the vaccine rollout. It was mostly big health systems who were asking for vaccine, and then we were also able to give vaccine to smaller systems, and then again distribute more widely to local health departments and to pharmacies who began to get to those unaffiliated healthcare providers. So that's why we didn't look at population for the first few weeks, because the focus of the vaccine delivery was really not on population, it was on healthcare providers and trying to access through healthcare systems to get to those healthcare providers. When we went to a more population-focused group, like people age 65 that are distributed throughout the state, that's when we recognized that that was going to be a flaw in our system if we didn't reconcile that. And so we very quickly did and added population into the formula, which remains. And as I mentioned earlier, we're now also working on a way to build in systematically ways to distribute vaccine as we look at places that are lagging behind. So, and as you know, it is Milwaukee, but if you also look at the map, there are a number of rural communities too that have some lags in vaccine as well.
Thank you for that. And let's try one more time to go to WJFW in Rhinelander. WJFW, are you on the call? WJFW in Rhinelander. All right, well, with that, we will wrap up today's briefing. We want to thank Deputy Secretary Julie Willems Van Dyke, Dr. Stephanie Schauer, and all of you for participating. We ask you to continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.